discuss one of the latest exam topics. Task is based on August 7th exam. Credits to aspirants who wrote exam on that particular date. OET speaking, cat bite. A 30-year-old man came to emergency department after a cat bite. You are collecting details from him and providing advice. Before we start the roleplay, let's start with introduction session.
Good morning, my name is Jennifer Capriotti. I am the examiner for the OET exam, conducting on 08 of August, 2021. Can you say your name for record?
Good morning, my name is Joseph Damien.
What is your candidate number, please?
My candidate number is 721567.
And you're taking the test as a nurse, is that correct?
Yes, that's correct.
Can I see your ID or passport, please?
Sure, here it is.
Now, we moving to warm-up sessions. They are not assessed. Basically, it's a chance to get each other's voices. In this part, I will ask you 3 to 5 questions before we move to roleplay. Are you ready, Mr. Damien?
Yes, I am ready.
Please, introduce yourself.
My name is Joseph Damien. I am a resident of India, currently residing in UAE. I'm a nurse by profession, and I have 10 years of experience in intensive care unit.
Could you please explain to me about recent trends and advancements in your profession?
In this era, we have seen a lot of changes and trends and advancements in my profession. When it comes to trends, the first and foremost is electronic, computerized recording replacing paperworks. Secondly, introduction of weight detectors, especially for veteran patients. And lastly, wireless machines. When we speak about advancement, the introduction of evidence-based practice and advanced technologies like robotic surgery, telemedicine, and geriatric nursing.
Why are you leaving your current position?
While my last job was an opportunity for me to learn and grow at a comfortable pace in a smaller clinical environment, I'm looking for new challenges and opportunities to continue to expand my knowledge. In a larger hospital-based environment, I am eager to try new things and learn skill sets that come from working in a faster-paced environment like this one here.
Whom did you learn most in your career?
I must admit, I learned a lot from my tutors, seniors, and my colleagues. But my real teacher is my own patient, because from them, I get a true picture of the quality of my performance.
What is your future plan when it comes to nursing?
Once I settled down in my dream destination, Ireland, I would like to research certain aspects of nursing care, like stress management and planning.
Thank you, Damien. That's the end of warm-up session, and let's begin roleplay. Here is your roleplay card, and you have 3 minutes to prepare. During your preparation time, if you have any doubts, please feel free to ask. All the best, Damien.
Thank you. Hello. Please come in and have a seat.
Thank you.
Good afternoon. My name is Damien Joseph. I am the registered nurse on duty today in this emergency department.
Hello, Damien.
How can I address you?
You can call me Samir.
How can I assist you today?
Nurse, a cat bite me a few hours ago.
In order to get a better understanding, can I ask you some questions regarding the incident?
Sure, nurse.
Mr. Samir, can you please explain how it happened?
I was playing with my cat, and when I received the phone call, I accidentally twisted with her tail. She got angry and bite me.
Oh, so sad to hear. Can you remember the time of bite?
Yes, it was almost 2 hours before.
Do you have any pain?
Yes, nurse.
Can you please rate your pain on a scale of 0 to 10? Where 0 means no pain and 10 is the worst pain you ever had?
Nurse, I will say 3 out of 10.
Okay, so it's a minimal pain. Can I provide you paracetamol, acetaminophen, or ibuprofen for pain relief?
No, nurse, I am fine at this stage.
Have you tried any remedies?
Yes, nurse. When I saw the bleeding from the bitten area, I immediately rinsed the area with sterile water.
Excellent, Samir. You did the right thing by washing the area. Did you apply any particular medication after rinsing?
In fact, no, nurse. I only cleaned. But I am concerned, as it is still bleeding.
I completely understand your concern, Samir. No need to worry. We can definitely help you.
Thank you, nurse, for the support.
If you don't mind, can I examine your wound?
Sure, nurse.
Thank you, Mr. Samir. I have completed the assessment. Based on my examination, I can confirm that your wound was bit deep and that's the reason it is bleeding. Tell me, Mr. Samir, when was your last dose of tetanus injection?
If I remember correctly, I took tetanus vaccination when I was in school.
Well, Mr. Samir, that means it was around 15 years ago.
Yes, that's right.
In that case, you need to take a booster vaccine now?
But, why, nurse? I already took a vaccine when I was a child. So, I don't think to need of repeating it.
Mr. Samir, tetanus is a fatal condition, and it is effective only for 10 years. In your case, it's more than 15 years already, so it is very important to take a booster. I am afraid to say this, if you didn't take it, sometimes it can cause muscle cramps, or locked jaw, and ends up on affecting central nervous system, and lead to life-threatening situation, or even death can occur. Is that clear to you?
Yes, nurse.
Now the next step is, a doctor will come and assess your wound, and provide appropriate treatment. Is that okay with you?
Is it necessary, nurse? I think I can manage the remaining care at home.
No, Samir, it's not like that. Like I explained to you before, your wound is deep, and it needs a proper evaluation from doctor, and your treatment may include antibiotic cream for healing. So, please wait for your turn to see the doctor.
Sure, nurse. I understand the situation. Good.
Meanwhile, are you ready for taking the booster dose of tetanus?
Yes, nurse.
Being said that, do you have any concerns?
No, nurse. You clarified all my queries, and I really appreciate that.
Thank you, Samir. Right away, I am going back to nursing station, and I will be back with your booster dose. In between, if your pain increases, please let us know. We can provide pain relief, as I explained to you before.
Sure, nurse.
In that case, I wish you a speedy recovery.
Thank you, nurse.
Thank you, guys.